I'm Bruce Steinberg. I diagnose and treat all problems ranging from the fingertips to the shoulders, skin to bones. Today, I want to talk to you about nerve problems, and in particular, carpal tunnel syndrome. In order to understand carpal tunnel syndrome, one must first know how nerves work. A nerve is like a garden hose. Just as water runs through a hose, electrochemical energy runs through a nerve. This picture demonstrates how electrochemical energy runs through a nerve in your arm. When a hose is pinched, the fluid running through the hose decreases. Similarly, when a nerve is pinched, the electrochemical energy that runs through the nerve decreases. It is this pinching phenomenon that can lead to multiple nerve problems, including carpal tunnel syndrome. In this picture, we see the carpal tunnel nerve, the median nerve, being pinched at the level of the wrist. When the median nerve is pinched at the level of the wrist causing carpal tunnel syndrome, patients will experience numbness and tingling as well as pain in their hand that usually includes the thumb, index, and middle fingers. When this occurs, many times the individual will shake his or her hand in order to obtain relief. In the carpal tunnel, there is a narrow, rigid canal formed by a thick ligament on one side and the bones of the wrist on the other. The carpal tunnel houses the median nerve and the tendons of the fingers. Swelling within the canal leads to squeezing of the nerve as it goes through this confined space. When the nerve is squeezed like a hose being kinked, the symptoms of pain, numbness, and tingling as well as weakness occur from the decreased flow of electrochemical impulses. In addition to having compression of the nerve at the level of the wrist, an individual may also have compression of the nerve at the neck from arthritis or a herniated cervical disc. In this situation, the nerve is like a hose with kinks in two places, both decreasing flow. Metabolic conditions such as diabetes, thyroid disease, kidney disease, and vascular disease may also affect the amount of electrochemical impulses that travel down the nerve, similar to a faucet on low flow. The combination of a low faucet flow and kinking of the nerve in more than one area can exacerbate the symptoms. A thorough history and careful clinical examination from the neck to the fingertips, and sometimes a test called an EMG nerve conduction velocity test, will confirm the diagnosis. Once the diagnosis of carpal tunnel syndrome has been established, the treatment is aimed at taking away the compression of the nerve at the level of the wrist. A simple over-the-counter splint in a few degrees of extension decreases the kinking of the carpal tunnel nerve. Anti-inflammatory medications such as ibuprofen will also help by decreasing the swelling of the tendons within the canal. When these remedies fail, an injection of cortisone into the carpal tunnel combined with a splint can significantly diminish the swelling, leading to decreased compression of the nerve and resolving the symptoms. If these conservative treatments fail to decompress the nerve, the canal space can be made larger. Surgery is aimed at opening the thick transverse carpal ligament that forms the roof of the canal, giving more room for the carpal tunnel nerve. By opening the transverse carpal ligament, the kink of the nerve is removed and the electrochemical impulses can flow more normally. Pain, numbness, tingling, and weakness can resolve if the nerve has not been significantly damaged by a long-standing compression. Surgical intervention for the carpal tunnel has significantly progressed. The old technique of an open carpal tunnel release, as shown, creates an incision within the sensitive palm of the hand. While this approach takes away the kink of the nerve by opening the transverse carpal ligament, the downside is a tender, painful palm. This drawback has been overcome by using an endoscopic device which allows the operation to be performed through a 1/4-inch incision away from the palm at the wrist crease. The median nerve is directly visualized, and therefore the contents of the canal can be safely decompressed by releasing the transverse carpal ligament. While this operation is more technically demanding than the open carpal tunnel procedure, with training and experience, this surgery is safer and leads to excellent relief of symptoms while allowing a faster return to full activity. Whenever possible, I utilize the single incision endoscopic carpal tunnel surgery and have performed over 3,000 of these procedures with exceptional results. If you would like to know more about carpal tunnel syndrome, learn about other aspects of the upper extremity, or read about what my patients have to say, I invite you to visit other sections of my website.